In this video, we will tackle about types of first aid measure. First, we have shock, causes of shock, severe bleeding, heart problems, losing body fluids, severe allergic reaction or infections, and spinal injury. So how to treat shock? Lie the casualty down, raise their legs, call ambulance, loosen tight clothing, keep warm and calm, and monitor their level of response. In the picture, you will see that the first aider is dealing with shock. Drowning. There are two scenarios in drowning. Scenario 1, the casualty is conscious. What you need to do? Place the casualty in a comfortable position. Cover the casualty and give them some dry clothes. Lastly, call the emergency services. In scenario 2, the casualty is unconscious and unresponsive. What you need to do are: lay the casualty on their back, tilt up their head and analyze their breathing, call emergency services. Lastly, act according to the casualty state. Wound. Common injuries that can usually be treated at home. All you need to do is clean and dry the cut, apply some pressure. What you need to do: wear a gloves if you have with you. Apply some pressure to the wound using a piece of gauze. Raise the injury, clean the wound, gently dry it, apply a sterile dressing. Fracture. Fractures occur when there is more force applied to the bone than the bone can absorb. Bones are weakest when they are twisted. Breaks in bone can occur from falls, trauma, or as a result of a direct blow or kick to the body. Things you must do if you are about to help a person. First, know the situation of the victim. Check if the casualty has the signs for fracture. First, deformity, swelling or bruising, extreme pain, wound or open fracture. Speak with the victim. It is important to inform the person that he is not allowed to move until the emergency services arrives. And lastly, support or hold the joints that surround the suspected fractured area. Burn. Scalds from hot liquids and steam. Building fires and flammable liquids and gases are the most common causes of burns. What to look for if you are helping a person suffering from burn: red skin, swelling, blisters on the skin, peeling skin, white or scorched skin. What you need to do: move them away from the heat, cool the burn, place under cool running water for at least 10 minutes, cover with a kitchen film lengthways. You can use plastic bag as an alternative of kitchen film. It helps the burn from infection. In the picture, you can see the skin burn treatment. Heat injury. Cramps. Cramps are painful muscle spasms, usually temporary, but can cause severe pain and immobilization. Can be made worse by heat and dehydration. What you need to do if you are helping a person suffering from cramps: first, rest the casualty in a cool position. Second, gently stretch and massage the affected muscles. Third, orally rehydrate casualty with water, fluids, and food containing electrolytes. And lastly, continue monitoring the casualty for any additional symptoms. Heat exhaustion. Typically caused by prolonged heat exposure along with the excessive strain and dehydration. It can be very serious or can lead to heat stroke if it left untreated. What you need to do if you are helping a person suffering from heat exhaustion: first, move the casualty to the cooler location. Loosen casualty's clothing and remove as many layers as possible. Orally rehydrate the casualty with water and electrolytes. Fourth, monitor airways and breathing and treat for shock. Heat stroke. Casualty has been exposed to heat for extended period of time. Casualty may have altered mental state and dry, hot, reddened skin. What you need to do if you're helping a person suffering from heat stroke: first, immediately move casualty to cooler location and request professional medical assistance. Second, cool the casualty by immersing in cold water or placing ice bags wrapped in cloth. Third, monitor casualty's temperature every 5 to 10 minutes. And lastly, monitor airway and breathing. Poison. Poisoning is injury or death due to swallowing, inhaling, touching, or injecting various drugs, chemicals, venoms, or gases. When to suspect poisoning. Poisoning signs and symptoms can mimic other conditions such as seizure, alcohol intoxication, stroke, and insulin reaction. Signs and symptoms of poisoning may include burns or redness around the mouth and lips, breath that smells like chemicals such as gasoline or paint thinner, vomiting, difficulty breathing, drowsiness, confusion, or other altered mental status. So what you need to do if you're helping a person suffering from poison? First, ask them what they swallowed, how much, what time, and look for clues. Call for emergency services, and lastly, reassure the casualty and monitor the level of response. Snake bite. Symptoms of snake bite: puncture marks at the wound, redness, swelling, bruising, bleeding or blistering around the bite, severe pain and tenderness at the site of the bite, nausea, vomiting or diarrhea. What to do if you are helping a person suffering from snake bite? Keep the patient calm, control the bleeding, put the casualty in a position which is lower than the heart. Do not let the patient move much and talk to them. Assure the casualty. How to treat snake bite. Call emergency services. Place the bite lower than the heart, control the bleeding, and lastly, keep the patient calm. You can observe the picture. Dog bites. If a dog bite pierces a person's skin, bacteria from the animal's mouth can get into the body, which can cause an infection. Washing the wound thoroughly can remove the bacteria from the body and help prevent infection. If the bacteria stay in the body, they can cause an infection such as tetanus, rabies, or sepsis. Symptoms of dog bites: swelling and redness around the wound, pain that lasts longer than 24 hours, drainage from the wound, difficulty moving the affected part of the body, a warm feeling around the wound. So how to treat dog bites? You can see in the picture that the first thing you need to do is place the bitten area under running water for at least 15 minutes. Second, wash the area with detergent soap. Next, apply antiseptic. And lastly, consult a doctor for an anti-rabies vaccine. Allergic reaction or allergy. Food allergy, weather or environment, various allergens. So what are the symptoms of an allergic reaction? So you can see in the picture that there are two symptoms, mild and severe. So how to treat an allergic reaction? First, call emergency services. Do not leave the patient. If the patient has anti-allergy medicine with him, let him take it right away. Place the person in a comfortable position. Lastly, proper ventilation. Take note that the treatment of allergic reaction will depend on the state of the patient. Anaphylactic shock. Symptoms: skin reactions, including hives and itching and flushed or pale skin, low blood pressure or hypotension, constriction of your airways and a swollen tongue or throat, which can cause wheezing and trouble breathing, a weak and rapid pulse, nausea, vomiting or diarrhea, dizziness or fainting. How to treat an anaphylactic shock? Call ambulance. Check whether the casualty is carrying an EpiPen or similar and help them to use it. Lie the casualty down with elevated to treat for shock. Monitor the casualty. Give them reassurance while waiting for the ambulance. Nose bleeding. The two most common causes of nosebleeds are: first, dryness, often caused by indoor heat in the winter. Second, nose peaking, occurs more often when mucus in the nose is dry and crusty. Colds also can cause nosebleeds. What to do if you're helping a person suffering from nosebleed, or if you are suffering from nosebleed, you can treat yourself. Get them to sit down leaning forward, pinch the soft part of the nose, and call for an ambulance if necessary. Hyperventilation. Symptoms of hyperventilation: feeling anxious, nervous, or tense, frequent sighing or yawning, feeling that you can't get enough air, or need to sit up to breathe, a pounding and racing heartbeat, problems with balance, lightheadedness or vertigo, numbness or tingling in the hands, feet, or around the mouth. Treatment: be firm but reassuring. Lead the patient to a quiet place. Explain to the patient what is happening. Ask the patient to hold their breath. This will reduce the respiratory rate. Encourage slow, deep breathing, and breathing through their nose will help them reduce the loss of carbon dioxide. Choking. What are the signs of someone choking? The universal sign for choking is hands clutched to the throat. If the person doesn't give the signal, look for these indications: inability to talk, difficulty breathing, or noisy breathing. What you need to do: cough it out, slap it out, squeeze it out, call 999 or 112 for emergency help. Keep repeating the cycle, and if needed, start the CPR. Dizziness. Causes of dizziness: pain, exhaustion, hunger, emotional stress, and standing or sitting when it is hot. What you need to do: lie them down, raise their legs, give them fresh air, help them sit up slowly, and if they remain unresponsive, prepare to treat someone who is unresponsive. Seizure. What causes seizure? Anything that interrupts the normal connections between the nerve cells and the brain can cause a seizure. This includes a high fever, high or low blood sugar, alcohol or drug withdrawal, or a brain concussion. But when a person has 2 or more seizures with no known cause, this is diagnosed as epilepsy. In the picture, you can see the symptoms: confused speech, muscle contraction, wandering, blank staring, chewing. And what you need to do is: do not panic, turn on their side and start timing the seizure, stay with the child, do not restrain, place something soft under your head, do not put anything in mouth, call 911 if seizure lasts longer than 5 minutes. So those are the types of first aid measure. I hope that you learned something from it. Thank you for listening.